We've done kidney transplantation pretty much the same way for 60 years now, and we've been waiting for a technological development so that we can catch up with other types of surgery. And finally, the Da Vinci robot has allowed us to do this with kidney transplantation. I first of all had to find a colleague to work with, and that's my colleague Ravi Parod, who's a very experienced robotic surgeon.
During my training, done some transplantation, but it's not my field of practice, and I think that Neil and I joined together to do the robotic transplant program because I had experience in robotics and he's obviously an experienced transplant surgeon.
We agreed to launch this program together. The next thing was to travel to India to visit a very experienced surgeon who's done several hundred of these operations, observe him in his unit, pick up tips and tricks. And then finally we did some additional robotic training in Belgium, really refine the technique and make sure that we were confident and happy doing it before we did it on our first patients.
So for the patients, the key advantage, especially with kidney transplantation, is the avoidance of a huge scar. So what the robot allows is a minimally invasive approach, just with 4 or 5 small wounds and a slightly larger one near the belly button. And this means that they're in and out of hospital quicker, they lose less blood during the surgery, and they have fewer complications after the operation.
About 4 years ago, I used to have a pupa done every year. And every year, obviously, you've got a comparison between the year before. And in the third year, they realised that there's something not right compared to your results of the second and first year. And then for the first 6 months, I went through different medical schools and hospitals to eliminate all the high-risk stuff like cancer, HIV, all the risk stuff. And then I had a biopsy and then realised that they reckon the kidneys are damaged a little bit. But in the last 6 months, the kidney started to tragically got worse, and he knew that sometime this year you will need a kidney transplant.
When I was pregnant in 2004 and I had just a routine blood test and urine test, the doctor asked me if I have any problems with the kidney or if there's any history with kidney problems in my family, and obviously the answer was no. So after the pregnancy, after my daughter was born, they've done some tests, and in 2007 they've carried out the biopsy, and my kidneys were working only on 40%. So this is when I was transferred to Royal Free, and this is when I was told that my kidneys are deteriorating.
In October, September, I was talking to Dr. Banga about he told me about this robotic. He told me, this it's up to you, it's your option. And I thought, what, according to the options, the risk, the recovery, I thought, why not?
I've done my own research, and both with my husband, and all I could see was the benefits only. And I knew that if anything happens during the surgery, then they will stop the robotic one, they will open me and do the normal surgery. So I just wasn't worried, because if you have a choice of having a cut which is like more than 10 centimeters and a cut which is 5 centimeters, then I would rather choose the one which gives me, less problems in the future, less chance of infection.
So for the surgeon, there are several advantages with the robot. The vision that you get from the robotic camera is unparalleled. It's 3 dimensions, it's high definition. The instruments that we use have wrists, and the wrists have greater range of movement than the human wrists do. And obviously you can do the surgery with an extra arm, so it's like having 3 hands inside the patient when you only have 2. So there are several advantages like that.
It's a big step forwards. We're one of the first hospitals in the country to do robotic kidney transplantation, and actually there's less than 20 hospitals in the world that are doing it.
I set my mind that this is going to be 2 to 3 months recovery, because you don't know. You can only listen to doctors and other people that say, look, you can't do this, you can't do this. But now I'm sort of 6 weeks, 7 weeks in, and I'm thinking, I was walking on the 5th day, up 2 stairs. I think that, like I said, from the pain side, I've had lots of different open surgeries. I've had a hip replacement, open heart surgery. I think this was the most riskiest operation, but I think for the recovery time, I'm really happy, really happy.
So I feel I've recovered very quickly. I feel much better than I was before the surgery, and the healing process was very quick actually. So yeah, I feel really good.
It was great that the Royal Free is pushing the boundaries with this, and that we're working in an environment that allows this to happen. We have, Neil and myself have sort of safely gone around getting approval for this technique, learning about it in the correct way, and then implementing it in a safe fashion, which with our first 2 patients has been remarkably successful, so we're very happy.
There is no risk here because, you know, the machine's designed to do what it's doing. It's going to give you less cut. Less cut means less risk, less infection. So all those things added up. It was a no-brainer for me, really. Even being first, or, you know, yes, the first operation took longer, but he had somebody there who's done 200 of them. So I was quite confident, actually, whether I was first or not first, that this is going to work.
Well, I didn't think about it much before, but now I feel kind of proud when I talk about it, especially with other patients when we meet, you know, in the clinic and we talk about it, because obviously we can compare things, and I know that I'm the one who's better off than them. So yeah, I'm actually kind of proud.